Welcome to the Sustainable Clinical Medicine Podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello, everybody, and welcome back. I am excited to introduce our guest today. We have Maren Mittals and Dr. Simon Mittals with us today, and they're going to introduce themselves to you, and we're going to learn a little bit about healthcare systems and how we can survive within them. And I'm interested to hear more. So welcome. I'll let you take it away.
Well, thanks for having us, Sarah. We really appreciate being here. Again, my name is Dr. Simon Mittals. I'm a physician, board-certified internal medicine. I've been practicing for 30 years. And when I say that, I feel like I'm super old. And I hope I don't come across that way. But yes, I've done a lot of different things. I started in the Army. I worked for a large health system. I did a lot of things clinically and administratively. Was VP of a hospital for a short period of time. And then really kind of figured out that, guess what, this isn't working, and so went back to school, got my master's in business, and then decided to start a consulting company, and have been doing a lot of different things in that. And then in the last few years, Maren, my wife, who will introduce herself, we've decided to team up because we both see very different perspectives on the healthcare system and really want to figure out how we can help it be sustainable for both those who work in the system, but also for patients as well.
Mm-hmm. And I'm Maren. I am a licensed clinical social worker, and I started off even back in grad school doing medical social work. So I did my training at MD Anderson Cancer Center in Houston and worked in long-term care, took some time off, and now I am in private practice for mental health therapy. And several of my clients actually are medical providers as well as students coming up into the medical field. And besides all that, I know what it's like to be on the homestead side of being married to a provider and feeling the impact of, the stressors of that from a family standpoint.
Got it. Okay. Where do we start? That's a whole lot of Maren, I think I might start with you and just ask you, what made you kind of that transition into the mental health aspect of your career? What was that journey for you?
Mm-hmm. Yeah, well, I think a big part of it was what we experienced as a family. Like a classic example is we were driving by the clinic and my toddler son waved at the clinic and said, "That's where Daddy lives." And I was like, oh, wow, that's my kid's perception here. And at times I felt that way too. So because of our own journey of figuring out, like, how do you serve in the medical community, something Simon absolutely loves, and still grow a family that we wanted to align with our values and to show up for our kids. So I think out of our own journey, I got way more interested in the mental health side and decided this is how I want to show up and support the medical community to give them skills that we didn't have when we first got married.
Mm-hmm. From a home provider, tell us what it looks like within that young family, and you're doing what sounds like a lot of the home duties. Tell me more about that load for you.
Yeah, I think a lot of it was the wrestle between supporting Simon, wanting to, really honor his career. When you're young, you want to do all the things to build up your career. And also feeling like a single parent. So doing all the things around the house. I remember one of my friends, coming over and I'm like, every single thing that's done here in my house, I've done that. Like I haven't had help. But that was always a wrestle for me, going, both are important and how do we make that work? So a big part of our marriage and our journey is navigating, balancing that, which I know that word is overused, but really trying to hold like space and capacity for career as well as family.
Was there anything you did to help support you within the role within the home? Maybe people you hired in, maybe things that you did that helped give you some of that space for yourself back in that equation?
Mm-hmm. Great question. I think that wasn't maybe as common in my generation. I see a lot of more millennials doing that, like asking for help. It was hard because we didn't have family close by, and we really didn't do a lot of hiring in. I even stayed home and homeschooled my kids for part of that time. But I think key is having my support system, like building into my friendships, getting together with other moms and kids, doing my own volunteer work. So I wasn't directly investing in my career path in terms of getting paid for what I was doing, but I was still showing up and fueling the things that were important to me.
Got it. Okay, perfect. I'm sure we'll come back to more questions about it. I'll move to you, Simon, then for a moment. So now you're an internal medicine physician, and then you end up a VP of a big hospital organization. So tell me more.
Sure. Well, it's one of those things where I think a lot of us get into medicine because we want to help people, right? That's sort of our core. And one of the things I kind of learned throughout my early career was I love helping individual patients, but the system itself needs help. And it can help a lot more people if we can look at things from a system standpoint. And so that really kind of fueled my leadership journey, if you will, to say, okay, let's start looking at this. And it's interesting, at least early in my career, if you speak up, you become the leader, whether you want to be the leader or not. And so that's kind of what happened for me in my early career. But as I really invested in that, I really learned a lot around process improvement and change management and strategic planning, and really starting to pull those pieces together. But rather than look at it from a 65,000 foot view, it was really saying, how do those things impact the people who are working on the front line and the patients that they directly serve? And one of the things I struggled with was there's all these decisions being made, and we say we're patient-centered, but really what I see is these decisions being made that are really for the system convenience, to help the system be sustainable financially, to grow the market share, whatever it looks like. And those things directly don't improve the outcome or the patient experience. And frankly, it doesn't help the frontline worker experience either. And so I think as I got more and more into it, it's like, okay, I kept thinking, well, if I get into sort of more senior leadership, that would give me more opportunity to have influence and to really direct some of that change. And one of the things I found, I think, and I think as I've coached a lot of physicians, one of the things I hear a lot is the system is so entrenched that it's hard to change it from the system standpoint, which then really fueled my desire to say, okay, if we're not going to do that, then how do we move forward? So when I went back to school and got my master's, my thesis was actually on how to help disruptive physicians. And that really became sort of an initial place for me to start saying, okay, physicians are struggling, right? And this was, before COVID, this was, years ago. But the reality is the problems that have maybe been heightened by COVID have always been there. And so now we're starting to talk about it more, but now what do we do about it? And so what I really started to think about is from a system standpoint, but also from a leadership standpoint, and also from a frontline worker standpoint, how can we really help them so that they are sustainable in their careers? We see so many people leaving the career, and it's disheartening, right? It's kind of heartbreaking a little bit, rather than saying, okay, what can we do to sustain? And that's really what's really driven that desire for me.
Yeah. So when you're in that clinical practice and you're adding leadership roles, are they paid? Is that something that you're initially receiving income for? And how did you get the training to take it to like next levels up? Because we know that what's needed at the team level in clinic isn't what's needed at the team level in the hospital. And you did that before your master's. So now we need to do all the things.
Yeah, no, it's a great question because I think for many physicians, they get sort of thrust into leadership because they, either they're good physicians and they're thought to be that will be good leaders, or they're the squeaky wheel and they're saying a lot of things, and so now they're given those opportunities. And one of the things I found in that was I was really ill-equipped to be a leader.
Mm-hmm.
Uh, I was a department chair for a while, and even that, it was like, oh my gosh, the learning curve was really steep, and there wasn't really a lot of mentoring that was going on at the time to really help support that. And so it really was on my own that I really like, okay, I want to do this, but I need to invest in that. And what does that look like? So I really went through a lot of physician leadership courses. I went through the American Academy of Physician Leadership, and really used that as a basis to start building a knowledge base. But frankly, not just a knowledge base. It was really about how can I make this applicable? How do I make this real? And so I think it was through those experiences. And as I learned more, one of the things you get a language which allows you then to have conversations with more senior leaders, because you now have a language to use that they understand, and now you have some understanding. So you're not trying to talk about just the clinical side. You're looking at from a strategic operational side as well. And I think that as I grew in that leadership style, and as I grew in my ability to have those conversations, it was like I was being not necessarily included as a C-suite executive, but really my voice started to have more influence, because it wasn't just, oh, this is about the patient and this is about good medicine. It's like, okay, but let's look at it from a holistic standpoint, and how do we put the pieces together?
Mm-hmm. There you go. Remuneration, was there remuneration for the roles that you had, do you think?
So for some of the roles there were,
Uh-huh.
some of the roles, and one of the challenges I think all physician leaders have is the sort of the decision point that comes up, right?
Yeah.
And that decision point is around how badly do I want to be an influencer, if you will,
Mm-hmm.
within the system, and how important is what I know I can make from a financial standpoint as a physician. Because
Mm-hmm.
I can make more money as a physician. I don't make as much money as a leader most of the time, and so
Mm-hmm.
I've got to make that decision. And depending where you're at in your career, that can be really challenging. I think I was sort of mid-career, and by mid-career, I kind of had enough comfortability to say I can do this, and also, you've kind of built up financially some stability, and so there's a sort of a timing that I think really makes sense. And if you look at sort of natural course of physician careers, that's pretty typical. Early on, a lot of excitement, really trying to kind of grind it out, and then you hit mid-career, and there's sort of a split that happens. Either you get really disenfranchised and you feel like you have no voice, or you try to get involved in a leadership standpoint, and that's really where that divide seems to happen most of the time.
Got it. Yeah. Okay. So when you're department head, is that when we've got little people at home, is that the kind of timing, do you think? Does that sound about right?
I mean, I think what's hard in that is the opportunities come when the opportunities come.
Yeah.
You
Yeah.
don't know, and oftentimes you don't know if those opportunities are going to be there in the future.
Yeah.
So a lot of times you sort of jump in and say, well, I don't know if this is going to be around in the future. This is my opportunity. Let me jump into it. And really looking back, I think, and this is what I tell physicians now is, guess what? There's always going to be opportunities. There's always going to be opportunities. And
Yeah.
so really timing it now, because I mean, I did it when my kids were young, and there were a
Yeah.
lot of challenges as a result of that, in my relationship with them, my relationship with Maren, and that really created some increased anxiety and stress that if I had waited a little bit, maybe even 5, 10 years, one, those opportunities would still be there. Two, I would have had more experience and had an opportunity to grow my leadership skill set. And three, I think it would have been a better approach for us as a family.
Mhm.
But again, I think we get into this phase of, I don't know when that's going to be available to me, so let me just jump in.
Yeah, 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 absolutely. We hear that a lot is I don't know if I should or shouldn't, and I don't know how to make that decision, and they're asking me, so I should say yes. Uh, Perfect.
Right.
Okay, tell me,
Well,
yeah.
and I was just going to say, I think part of it, especially as healthcare workers, we have this heart to serve, right? So if
Mm.
somebody's asked me to serve, guess what? My natural instinct is to say yes, without really necessarily thinking. And I did a lot of that early on in my career. I did a lot of yeses without really thinking about the impact or the consequences of that for as a family.
Yeah, yeah. So tell me about you in your clinical role and what was coming home with you, what wasn't getting done within the day, where did these roles kind of push other things out into the other spaces? What was
Yeah.
it looking like day to day for you and yourself, Maren, as well, obviously, because you're the one kind of juggling this as well.
Yeah, and I'll just start off by saying I think Maren had to tolerate a lot during that period of time, and um, what was happening is I was actually staying at the office super late. I mean, I would be there till 8, 9 o'clock in the evening. Whether it was charts or whether it was the leadership role or whatever it looks like. And one of the things that I think is very common is when you're busy, right? I had a busy practice on top of these leadership roles. You're trying to sort of squeeze things into the gaps. And there
Hmm.
aren't very many gaps. So then the
Hmm.
question is, if there aren't many gaps, what do I do? So I'd get there early, I'd leave there late, and I try not to bring it home. That was sort of my mantra. But realistically, I was always bringing it home because I was always thinking about it, right? So I was never really as present as I would have liked to have been as a father, as a husband. And I think I hear that a lot. I think there's this idea of, well, if I'm doing it at home, I'm at home. And there's just a reality that even if we're doing it at home, the work is still not allowing us to be present. And it takes away the self-care piece. So when you talk about what gets pushed out, self-care by far is the number one thing, right? We don't take care of ourselves. The second thing is relationships, because we think all the work we're doing is quote important, which it is, and then we say, well, it's too important for me not to do. Therefore, I'm willing, even unconsciously, to sacrifice relationships and with our family, but also with my social circle. So during that time, I really had very little support, very little of a support system. So then I was feeling like I was on my own, running on a treadmill, trying to figure it all out, and frankly, it led to kind of an emotional breakdown.
Mm. Yeah, yeah.
Yeah, and I think from my viewpoint, what I'm thinking about is like skipping ahead to current.
Yeah.
We're empty nesters now. And, Simon does some clinical, he does medical directorship, he does coaching, and we have our coaching business, and it's still something we need to think about.
Yes.
It's still
Mm.
on our plate. So I think in the beginning, we used to think like, if you just make this one change,
Right.
we're going to feel balanced or
Right.
it's going to feel really good. Well, I would say Simon has the career he absolutely loves. Like, I don't know if it could even really get better. Like, he loves it. And we're still having these discussions every couple months, starting the new year. Okay, is there anything we want to adjust? So, really, I think that question for providers doesn't ever end.
Right. And I think also it's I think the character of the question has changed,
Hmm.
um, because I felt very kind of ashamed of what I was doing to some degree, because I knew
Mm.
I wasn't being there and present, but I
Hmm.
also didn't know how to stop it. And so part of that has been, now that we still have those conversations, now there's more freedom to make choices around it. And I think that's ultimately where providers struggle, is, do I actually have a choice?
Mm.
Not, right? And the reality is, yes, you do. They may be hard choices, right? They may not be easy choices, but we have choices. And I think
Yeah.
to empower people to recognize that can be really, really powerful.
Agree. Absolutely. Tell me about the VP. When you're a VP position in the hospital, what does that look like? Like, what are the hour commitments? What are the times at the doing that role look like? Were you doing clinical as well? Like, just a little bit more of a understanding of that.
Yeah, I was doing both clinical work and the leadership role. I think I was, I can't remember what they paid me for, but I think I was doing probably 70, 80% of clinical, and then maybe 20% was towards my VP role.
Hmm.
And the day was really around working with the CEO of the hospital around anything around medical concerns that were happening, whether it was quality, peer
Mm-hmm.
review, whether it was concerns about conflicts that weren't being managed, whether it was developing new, programs. We developed an ethics committee, right? I mean, there were just all of these pieces. And one of the things I found is, and this was a while ago, right? So this was
Mm-hmm.
what, 20 years ago, maybe 15, or no, about 20 years ago. And one of the things that I think has changed is CEOs didn't know what to do with CMOs or VPs in as physicians. And so I think there was this struggle for a long time of, oh, okay, you're here, I want you here, but I'm not sure what to do with you, right?
Mm-hmm.
And to some degree, there's still some of that, right? In the CMO role, in these VP roles, in these executive roles, it's like, I know I need you. I think this could be helpful, but I'm not sure how. And I don't even know sometimes what the metrics are of success, right? And so that becomes then challenging, especially for leaders. I think they feel like, so am I important enough to be in this role? Do I have a voice? Do I not have a voice? And I remember going through that even in my own roles of saying, okay, if I'm in this position, I want to do this. I'm here because I want to do it. But then you realize there are these sort of guardrails that people don't want you crossing, right? So they don't want you to cross too much into HR, or too much into strategy, or too much into
Mm-hmm.
operations, or right, or so too much into understanding marketing, or
Mm-hmm.
market share. And so I just found it very interesting being in the system, wanting to make good changes, really provide some insights into what was happening on the front line, and then realizing that these guardrails are really designed to keep us in these relative silos that doesn't allow for that kind of change management that's really needed.
Got it. Okay. Interesting. So was why the master's in business then? What was it about the master's program that you had decided was an important piece for you next?
Yeah, so that's a great question, and I think a lot of it for me was, so the master's program I did had an entrepreneurial focus.
Mm-hmm.
And I was really starting to get into the idea of, I really think I want to do something outside of the system, but I really didn't have a good understanding of how to do that. And I also wanted to sort of elevate my marketability, if you will, as an executive, to say, so I'm not just a physician who's had leadership experience, I have some credentials that support that as well. Um, and again, this was a while ago, so not a lot of masters trained physicians at the time, and now we see a lot more, which I think is a very good thing. But I think what ends up happening then is, as I got into that role in the program that I was in out in at University of Southern California, I realized that in the cohort of physicians I was working with, we were all struggling with the same things. Right. And a part of it was people wanted to stay in the system and try and figure that out. And some of us were saying, let's get out of the system and figure this out. And so I think for me, I just felt like getting out of the system was going to be my best way to really approach it. But having the masters would give me some credibility, as well as having had the leadership experience.
Got it. Okay. Yeah. And then you mentioned disruptive physicians and you wanted to work with them and identify them and tell me more about what your definition and understanding of what that meant was.
So again, great question. I mean, disruptive physician, that term is actually an old term, right? And it really is disruption in the workplace, right? Whether that's from an emotional or psychological safety standpoint, whether that's from an operational standpoint, whether that's from somebody who maybe even unwittingly is sabotaging process or sabotaging outcomes. And so it was really the idea of people who are unaware, they had relatively low emotional intelligence because they didn't have the self-awareness to recognize how they were impacting the systems they were engaged with, and then recognizing we don't really have a great support system for that. What we do with most disruptive physicians is we say, hey, you're not being a good player in the sandbox here, so make a decision. Do you want to play in this sandbox, or do you want to go somewhere else? Rather than saying, you've got some challenges, we really want to support you. Let's get you some insight. Let's really understand what's going on. And now let's support you so you can be successful because you are good at, typically most disruptive physicians are really good technically from a clinical standpoint. Their patient satisfaction scores tend to be very high. And so it's not so much that they're struggling in terms of their patient facing roles, it's their non-patient facing roles that they really tend to struggle. But it's very, very disruptive. And this is happens in the ORs and ERs and hospitals and clinics, and I mean it's pretty rampant. And so systems didn't understand how to manage that. And so now by creating some systems around it, I think we now have a better sense of we don't have to jump to leave, play well or leave. Let's talk about what's maybe some of the underlying issues and let's really manage those. And I think that comes from both a mental health standpoint and from coaching that allows people to understand there are people who've been through this, who understand the system, and they can help support. And I think that's where peer coaching really has a strong place for.
That's interesting because we talk about disruptive physicians now, totally the opposite, the ones who want to look at a system, say this is not
Right.
flexible, there's no flexibility here. I want to do these big grand ideas and kind of pull the whole piece of their world forward
That's
in
right.
something in regards to the disruption of same. And
That's right.
so I find it fascinating that you're like, no, we're talking about the disruptive, like need disciplining kind of
Right.
things. And
And
then
and
we're
and it's
talking,
interesting that transition, right? That
yeah,
transition has really happened over the last 20 years, where we used to talk about the sort of disruption as a bad thing. And
yes.
now we're looking at disruption as really this good thing of saying, hey, we've got some challenges in the system. What do we do to change the system that really allows us to for us to do what we say we want to do? And
Mhm.
that's a lot of what we talk about is there an alignment between your values, your mission, and your purpose? Because if there's no alignment, then no matter what you're changing, what you're doing is just changing for whatever reason, but it's not necessarily aligned. And so I think that disruption we have now is can be a very positive force in the healthcare system.
All right. So we finished master's program. Did you work as you studied your master's program? Were you still clinically working?
Yep. It was because we're a glutton for punishment, most of us. And so yeah, it was a tough time. Maren probably can speak more to that. I mean, I was gone because I was working, and then I would travel once a quarter for an intensive, and then I'd come back, and then I'd have homework. I mean, it was a really challenging time.
Yeah, full-time doctor, full-time student
Yeah, it was.
for like 13 months.
Yeah,
Yeah.
it was a pretty intense course, and really looking back at that time, um, so I look back and say I'm glad I did the master's. I look back and say, man, I missed a lot. I missed a lot in my family. I missed a lot with my kids, and so again, this kind of goes back to what we were talking about before about timing. When is the right time to do those kinds of things? And I will say, I think when I mean, Maren and I do some generational work, the generations in the workplace, I do think some of our millennials and are really starting to think differently around when to do that kind of career progression. And I think they're really looking at it from a standpoint of, well, okay, my family is really important to me now. How do I invest in that? And how do I invest for the future, and what does that look like? And I think those are some of the challenges that I think still exist.
Okay. All right. Then right now, then when you're working with physicians or teams or other healthcare providers, whatever that's looking like for you in your current place that you are now, what are we working on? What are the things that you've grown in your expertise that you're really taking and moving forward? What does that look like?
Yeah, we're really going through the lens of relationship, emotional intelligence, like basic relationship skills and how do they apply to teams, to leaders, and to the workplace as a whole. So a big focus that we do is building trust. I mean, it sounds so simple, and yet, man, there's so many people that don't really feel that emotional safety at work or don't feel like they can trust their coworkers. So we're incorporating those relationship, emotional intelligence skills as we equip leaders to lead productive, effective, collaborative teams.
One of the things that, I mean, it's interesting, even today I did a presentation on customer service. And really one of the things that's at the core of customer service, which is the same as leading teams, is relationship, as Maren said. And so it's really about, and I know another one of your podcast talked about this, about being um, feeling seen, heard, and valued. And we
Yeah,
really
yeah.
believe in that, right? That's really important. And that happens no matter where you are in the organization, right? Whether you're a leader, whether you're a frontline staff, it doesn't matter. Whether you're a patient, everybody should feel that, right? That's the interactions we want. And so even in talking about customer service today, I mean, that was really the framework of how do you actually listen, not only to the patient, but to their family or to your coworker or all the stakeholders that may be involved in that individual's journey through the healthcare system, which most people are really scared about. They don't like being engaged with the healthcare system. So what do we as workers, what do we have? We have opportunities here to help individuals navigate that. And I just don't think we do a great job. In most systems, we kind of shuffle people from place to place without really, one, a lot of clear explanation. Two, there's not great communication. Three, there's not a good process in terms of why am I repeating the same thing over and over again every time I go see a doc or a provider? And so it's those kinds of systems, but they're really based in relationship.
Got it. Okay, so it's helping that team be able to work better in relationship with each other and building some of the skills in relationship with patients, with the team members of all the levels within the team. Tell us about systems. Is there anything about moving or shifting a system as a little person in the system?
Well, I think often, what ends up happening for most individuals is I think they really struggle because they're not sure of what voice they have. And so the first thing is really to clarify, what kind of voice do I have in the system? Do I have a voice that is going to be heard, that matters, that is bringing insights? I think a lot of times when we hear that, we sometimes kind of fall back into the person who's sort of always complaining, and that's not what we're talking about, because we're really talking about people coming in, and we talk a lot about zero negativity. We're coming in with positivity, right? We're coming in with hey, I have some concerns, and with curiosity, is saying, let me understand, why are things this way? What is it about the system that is gained by having a process or a system in a specific way? So I think a lot starts with curiosity. A lot really is about your own personal values, and I want to bring that into the world. What does that look like? And then I think it's about finding those areas of influence. So we talk about kind of empowerment, but it's also empowerment without influence doesn't really get you far, right? So empowerment gives you the choices, but the influence is then, okay, how do I make that disruptive change, right, for good, which I think is really, really important. And so, how teams are designed, is there really engagement, and is there really an alignment between the values and the mission of the organization? So using that as a platform, that can allow people to actually have more influence within the system, saying, I'm for the system. I want the system to work, and the system doesn't work. And here's where it doesn't work. One of, I think, the challenges that we have as leaders, and frankly, even as frontline workers, is there's not enough transparency to know what the impact is of any one change across the system. So for example, if I change let's say a scheduling process in a clinic, right? I think, well, that makes sense, right? It makes it easier, but then we don't necessarily talk about, well, what does that mean? Does that change capacity? Does that change access? Does that change my ability to be effective? Do my outcomes change? What does that mean for other departments that are referring to this department if I change schedule? So again, we don't necessarily think about all of the ripple effects. And so it takes kind of a step back and a step in, right? A step back to look at the system, a step in to say, okay, now that I know this is where I know we can have the biggest impact.
Yeah. How does one start to, so they notice they have choice and they think, hey, if I change my schedule like this, it would improve my access, because we talk about this a lot in that redesign of that day, to try and help the number of items be easier to manage, because you're able to use your access, for instance, to be able to manage some of those things in person. what does it look like to bring a team together to talk about this new idea, or to see if there's ability to influence the system? When somebody has a good idea, they've decided they have choice, they want to take it to their team or organization at large and say, is this a good idea? Because that takes a lot of vulnerability.
Oh yeah,
I was
for
talking
sure.
to one of the physicians on the podcast about he wanted a lunch break in the middle of his scope stay. And, he's a senior physician. He's been in the organization a decent amount of time. And he's still questioned if he should be asking for this and what effect it would have on the team. So if we're talking about the physician in their day saying, I think that if we did this, that could be a really helpful improvement for more than just me, where would they start? What do we start to do to be curious about who we would talk to about that, how we would start to influence change?
So I'm going to jump in and
Yeah.
say what inner work needs to happen first.
Yeah.
And then
Mm,
Simon can address your question. But to me, it really starts with getting clear what's going on inside of me that is desiring that change. One thing that Simon and I work with leaders all the time on is their own values. We talk
mhm,
about organizational values, but if I, value a sense of respect, am I giving that value to myself as well? So, really, to me, it starts with clarity what's going on inside of me? And then that informs, okay, this is the change that I want to make.
And then when you've identified that change and you understand the reasoning internally for it, then you can bring that forward. And what I usually recommend is one, you find who your immediate supervisor is, whether that's a department chair, whether that's a section chair, whatever, or however the organization is designed. And what I recommend is, can we get a team of stakeholders that are wanting to have this conversation? Because I think what we tend to want to do is say, I'm going to hand this to the leader, and you figure it out, and that usually doesn't go anywhere, right? And we know that, right?
because it's not their
And
priority.
it's not their priority, right? Exactly. And so what we're doing is we're putting something on their plate that's already overflowing and expecting them to continue to manage it, and that's just not realistic. And so really it's the ask of, can I get some stakeholders together and talk about this and then come to you with some recommendation, so that it isn't so much you've got to figure it out. I'm going to help you figure that out. I want to collaborate with you. And then as you pick the stakeholders, some of the things that I really talk about we talk about is, when you form a team, it's how do you set up the parameters of how the team is going to function. And what we talk about is circle of safety. This is a
Mm,
safe place, right? We really establish that psychological safety where people can share vulnerably, to your point. I mean, sharing these ideas can be very vulnerable, and also without negativity, without sort of bashing it down to say, huh, I'm not sure I would have seen it that way, but I'm really interested to learn more. So really
mhm,
setting that stage within the team to say, the team is here not to necessarily fix a single problem. It's to really understand the different perspectives without judgment, right? Without casting judgment on individuals or on individual ideas, and then being able to process that and say, huh, can I see these different perspectives, and what does that look like if we bring them together? And so it really takes some sophistication in the team dynamic side, right? And I think that's the piece that often gets missed when we bring teams together. We say, okay, I'm going to bring the nurse exec and I'm going to bring the physician exec, but nobody talks about how the team is actually supposed to function. And so we really teach teams, if you're going to be effective as a team, it has to be safe. And it has to allow for vulnerability. It has to allow for different perspectives without judgment. And it has to bring in positivity and curiosity. And then that allows for a really good process that's collaborative to come up with some really good innovative ideas. So even if I have the idea, am I willing to say there may be other things here that I'm not aware of, and can I now maybe even adjust my perspective or adjust my idea, because now I've got a bigger scope to pull from and a bigger pool of information.
yeah,
Uh,
that's really good. Yeah.
Sarah, one of the things that we teach our teams and our leaders is that a basic concept, Conflict is the objection to difference. Conflict. So as people start to understand, we can help them go, but we can move beyond that objection. We can move beyond that defensive reaction and simply notice it's normal to have that objection. And how can we turn that around to that curiosity? And when people feel safe, they're way more likely to be creative and open to other perspectives.
Yeah. And defensiveness often stops creativity, right? I'm here to protect my turf or my idea, right? Rather than, I'd really like to be curious about that. And that allows us to break down silos, and it allows us to then really have cross-functional teams that can be really effective.
Yeah. I know that part of a lot of the quality assurance work that physicians are doing or being asked to do in Canada right now is that watching their clinic processes, watching their practice processes, and saying, what do you notice? And what do you want to achieve in the next 12 months? Because they want that quality assurance to have impact. And then we know that if you come in with a great idea and say, do this, that's not going to go down very well because it's another do.
Right, exactly.
And so having these conversations and these development of relationships and knowing who's the right people to start that conversation with and get perspective, gain understanding, be curious. Part of our access improvement management teams was that exact process of who are the people who need to be in the room for this? How often should we meet? How often do we check in and get perspective and see how things are going? As part of that ability to start to grow these skills. We're being told to do these things, make an action plan, go have an impact.
That's right.
That's where it stops.
Yes, that's right. Well, it's interesting. I do a lot of process work, and one of the things I ask a lot of questions, right? And I think asking questions allows people to feel like, and I tell them up front, I'm asking questions not because you don't know, and not because I'm trying to put you on the spot. I think it's really about how do we understand the problem so we know what we're actually fixing? Because we think we know. I mean, how often do we say, well, if we just had more staff? Well, that usually isn't always the fix, right? It may be, right? Maybe part of it, but there's also a process piece, there's an understanding piece. And how do we get to those pieces is really through cross-functional teams. And because no one silo is going to have the answer, right? And so we have to have the access to those different perspectives.
Yeah. Those ripples you talked about, how will this impact everything else? And not even understanding how, but this is just a great idea. And then but the impact and the ripples of, yeah, that's a great idea, but I don't have the time to do that. Going to need to have something else, done differently. So I've got the capacity to do that if that is our truly decided on priority.
Right.
Yeah. Fascinating. And then taking that even higher in organizations, the ripples get even more complicated.
Yes, they do. Yes, they do. And it's interesting as you get higher up in the organization, what I think we both have seen is the need for even higher levels of emotional intelligence, of saying, because that's really where the impact is, right? If you think about the impact at the front line, it's almost always an emotional reaction, right? I don't like this. I can't believe we have to do this, right? I mean, there's this sort of emotional reaction to it. And so that really requires then at higher and higher levels of leadership to say, can I be aware? But also, how am I reading my organization to say, I understand what they're going through? And that's an empathy piece, right? That's an empathy piece. And so that's required for really healthy organizations to empower the front line, but also to challenge themselves and the organization for change. And again, I've been in organizations where it's almost like they're afraid of the change. They're afraid of what will happen because they don't know what's going to happen, right? So uncertainty leads to anxiety, and anxiety leads to paralysis a lot of times. And so how do we bring as much certainty? Well, the only way we can bring certainty is by having cross-functional teams, right? I can't bring certainty if I, as a doc, say, well, as a doc, this is what I think should be best. Well, again, if I don't know the ripples. So again, even at senior leadership levels and the C-suite level, that level of sophistication is really needed to be effective and to really bring that organization in alignment with the mission and purpose that you exist for.
Mm. Where do people reach out to find out more or hear more of what you're doing in the world or how to work with you?
Well, we are both on LinkedIn, and we have our company page, smmcoachingconsulting.com. And we're on LinkedIn. We're putting out newsletters with really practical tips, encouragement for people. We're also on Instagram too, Facebook, and we have a YouTube channel with some tips for leaders in the healthcare sector.
I think that we have a number of programs available for individuals. We have, and for organizations. We do, one of the things that I really appreciate about your podcast is the idea of sustainability. What does that look like? And when we look at that from an individual standpoint, we know burnout is rampant, right?
Mm-hmm.
This podcast is a testament to that. And
Yep.
and one of the things that we really want to do is how do we help people build resiliency? Right, which is really the way. So we have a mini course that's available called the Path to Resiliency. That's really designed to help individuals do that. We also go ahead.
Sorry, with resiliency, what do you mean by give me more about what is the definition in this situation for resiliency? Like, what are you meaning to help us to understand when it comes to resiliency within that burnout piece?
Sure.
Mm-hmm. I think for me, some of the key components are increasing our capacity to hold seemingly opposing things. I could feel frustrated at work, and I could feel like I can show up and make a change. So increasing our capacity, and also having some hope and joy for my experience and for what's to come. So to me, those are key components.
And I think part of it is, how do you develop that, right? What are the skills needed to do that? Because as an individual, as we've kind of talked about, it's really hard to change the system. And so my circle of control is about me, right? That's my circle of control. So what can I control? I can control how I take care of myself. I can have control over boundaries. Maybe hard, but I have control over it, right? I have some control over how I show up. I have some control on when I need a break, right? I have some of those pieces, and that's where resiliency gets built, is saying, okay, here's where I'm at. I'm aware of it. Here's what I can do about that. I'm struggling today. How do I find hope? How do I find gratitude? How do I find that place, that grounding place that says, I can still enjoy this job even when it's frustrating? And so those are the kinds of things that I think can really build resiliency. And I think that, again, leads to that sustainability for individuals.
Yeah, thank you for that. It's nice to be able to understand what you mean, because sometimes things like words like balance and resiliency can really be like flaring words. And so if we just kind of piece it out a little bit to have some understanding and that curiosity, it's like, oh, I see what you mean.
Yeah, exactly.
Yeah, perfect. Thank you.
Yeah. And then, I mean, again, I think, other things that we've got, we really help organizations through leadership development programs. We've got helping leaders through what we call a hybrid program, a leadership development program, which includes one-on-one coaching as well as online work. And then we do customized solutions for healthcare organizations as it pertains to how do you get that alignment? What does your strategy look like? How does that translate into operations? How do we help your leaders actually engage with your staff? How do we help your staff engage with each other as well as with those that they serve? So we really try to customize those solutions, because we know each organization has got a different culture. And so how do we incorporate, or if the organization wants to change the culture, which often can be the case, how do you change culture? Because culture isn't going to change just because you did a presentation and something, right? It takes some effort.
Yeah, perfect. Well, thank you so very much for this, for both of you, for being here. Is there anything we didn't discuss that you would like to talk about before we head off for the day?
One of the things coming to my mind is we often hear, it's expensive to invest in leaders. And there's studies coming out that show actually you have a high return on your investment. For every dollar that you spend on leadership development on your team, there is often like $7 return. So I mean, that's pretty good. And the reality is, if we want to equip providers and healthcare employees to stay the long term, to stay the long course, investing in people's growth, I mean, is totally worth it.
And just to keep in mind that, when we look at studies done on turnover, people leave for money. Yes, that's for sure. But really, it's relationship with their supervisor. How do they relate to people at work? Do they feel like they've got friends at work, right? I mean, those are the kinds of things. So how do you develop that, right? And we really are passionate about how we bring that into organizations.
Yeah, super important. We hear that a lot, that is not a sustainable place for me. This is not a safe place for me anymore. There's been a breakdown of trust. I hear this type of talk all the time, and I just wish they would understand me and have come and even asked me about that before they made that change. And you can understand that level of frustration equaling, I can't stay here, it's not safe for me. So thank you for this conversation. Thank you for your work in the world, building leaders and potentially impacting all those organizations that do tend to be still potentially disruptive in both sides of the coin.
That's right.
Yeah, thank you so much for having us.
Yeah, we're so glad to be a part of
this. Very helpful. Thank you. Have a great rest of your evening, everybody. Bye.
Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.